how do we evaluate and treat rotator cuff pathology? First, we got to figure out, is it a painful rotator cuff that is intact, or is it a rotator cuff that has a partial or even a full thickness tear where it's now tearing away from the top of the bone? If that's the case, we have to start tailoring our treatments. First and foremost, oftentimes if it's atraumatic rotator cuff pathology, physical therapy is sort of the mainstay of treatment. Now, if that's not good enough after 4 or 6 weeks of comprehensive therapy, and by the way, about 70 to 80% of the time, that will be effective for you. That's why we start with therapy. But in the cases where the pain persists or isn't feeling well enough, then I'll usually get an MRI at that point. And in order to evaluate the anatomy of the rotator cuff, and then we can look for things like tears, tendinopathy, which again means the tendon is intact, but the tendon quality is a little bit degraded. Once I have a sense of that, then we can either continue therapy or potentially offer other treatment options.